So today we're going to talk about handling emergency situations and how to be prepared and have a plan with good communication. So it's required to have an emergency action plan in place within sports medicine. So you should have a specific plan for each location, meaning if you have a football field, you'll have a different plan than you might have in a volleyball gymnasium. You need to have a plan for equipment removal if the athlete is wearing protective equipment. You need phone or cell access. Know the community-based system. So make sure that your plan includes communicating with your community EMTs or emergency system. Make sure keys to gates and access roads are always accessible in the case of an emergency. The staff needs to know the plan and review it annually. You should assign someone to accompany the athlete if there is transport. Contact information should always be available of the athlete's family. And then you want to work with local EMTs and fire response. So you'll do an on-the-field assessment. If it's an unconscious athlete, you're going to do a primary survey, which is to check their airway, their breathing, their circulation, signs of shock, and you're going to look for profuse bleeding. In this situation, you will call 911 and care for the athlete until they arrive. Airway, breathing, and circulation. You want to check for breathing. This is usually done by watching their chest rise. Look for their mouth to move. Look, listen, and feel. Use a barrier mask for rescue breathing. To open their airway, do a head tilt or a chin lift, whatever is appropriate. You're going to check their pulse at their carotid artery within their neck and have an AED available. Look for signs of shock, a low blood pressure, normal being 100 to 140 over 60 to 90. The systolic is, if it is below 90, is a sign of shock. Check their pulse to see if it's rapid or weak. A normal is 60 to 80 per minute. And the athlete may appear drowsy or sluggish. Respiration is shallow and rapid. A normal is 12 minutes per minute. And an adult, or 20 to 25 in children. And then look for pale, cool, clammy skin. Profuse bleeding, direct pressure is applied. Elevation is utilized when possible. And remember to use pressure points, either your brachial artery for an upper limb, found in the medial aspect of the humerus. We'll discuss this on page 203. Or the femoral artery for a lower limb, found in the femoral triangle on page 203. Again, we will go over that. On the field assessment, for a conscious athlete, you're going to do a secondary survey. Check vital signs. Check their history of what happened, how they're feeling, their musculoskeletal evaluation, then come up with treatment considerations and transportation. A secondary survey will determine the seriousness of the injury, the type of first aid needed, whether a physician referral is necessary, and whether there's a type of transport necessary. Your vital signs: pulse should be 60 to 80 beats per minute. Your respiration is 12 per minute in adults. Blood pressure normal would be 100 to 140 over 60 to 90. Females can be lower. Temperature 98.6 or 37 Celsius. Check their skin color. If it's red, you could be looking at heat stroke, high blood pressure, or high temperatures. If it's pale, it could be a lack of circulation, shock, fright, hemorrhaging, heat exhaustion, insulin shock. If it's blue, within the lips or fingernails, it could equal airway obstruction or respiratory insufficiency. Other vital signs, your pupils, they should look equal and react to light. Their state of consciousness should be alert and aware of their environment and respond quickly to vocal stimulation. Weakness of movement, check this versus the other side of the body to look for nerve damage. And sensory changes. Is there any numbness, tingling, or loss of sensation? HOPS. This is the method we use to evaluate an injury. You start with H for history. What happened? Has it happened before? What did you feel? And be thorough. Observation. Was the incident witnessed? Observe the area and surrounding areas, looking for swelling, abnormal bumps, and bruising. Palpation. Feel the structures involved carefully and compare them to the other side. Try to get a pinpoint idea of where exactly it hurts. Special tests can be done specific to the joint or the muscle, and we will learn these basic special tests in the future. Treatment considerations. Price, which is protection. You're going to protect the area either by a splint or maybe a wrap to protect it. They will be resting. We're going to remove them from activity. We will be icing appropriately using compression, some sort of a wrap to hold the ice in place and give the structure compression. And we will elevate the injury as able to do. Transportation, field removal, we can use a spine board. You can give them ambulatory aid. We have an injury cart for removal, or sometimes a sports chair, which is a rolling device that can get them off the field. Is there a physician referral needed? Or are we going to ambulance versus splinting them home and sending them with family? So the lab that we will be doing in this class is going to be the following. You're going to get a partner or a family member, and you're going to get their pulse at the carotid artery. You're going to measure the number of breaths they take per minute. Take a blood pressure reading. Get their temperature. Identify their skin color. Check their pupils to see if they're equal and reactive to light. Measure their state of consciousness. Are they alert, aware, and quick to respond? Is there any weakness in the musculature or the area that you're checking? And is their sensory normal? Does it feel the same on both sides, or is it dull or sharp?